our practices of beading and sewing, making garments, preparing for those things that we need to do. The outdoors is still, for those of us that aren't on indoor quarantine, the outdoors is still free range for folks. So I have family that's preparing to go out and do beaver trapping. And so learning how we can be in those smaller groups and do exactly what we have prepared for thousands and hundreds of thousands of years to do as people. How do we live? How do we eat? How do we learn how to be real people on the land or in relationship to ourselves? My friends right now are things like food, things like cleaning and caring for my environment, things like talking to my aunties on the phone, things like meeting you today and having this opportunity to process this really difficult time, but also get information out to people that I feel is so important for every single one of us to prevent the things that we have seen in the past. There's a lot of fear about, well, our communities have been through times of epidemics. When the 1918 flu came through our community, it was devastating. It's things that people don't want to talk about, that folks were feeling so ill and in such poor condition. It was said that folks who had passed away were stacked like cordwood until we could care for them. And so many had died that we had to put them in unmarked grave sites. This is terrifying information, but I know this already before the pandemic. And so knowing that I am a survivor of only a very few people who survived the epidemics in the Upper Innoko Mud River Flats area, that's a part of who I am. I know that we can survive epidemics. I know that we can survive this pandemic, but we should best use our traditional caring and our traditional values for caring for our communities and our elders to motivate us to use the science. And the science shows social distancing is our tool that we must use now.
I've been hearing a lot about, well, I guess not a lot, but here and there about some gatherings in town outside, keeping a safe social distance from one another, so 6 feet, but all being together outside. What do you think about that?
I think that it sounds really fun for me to go out and see people after being on quarantine. But I also have to look at the science. And so in this case, I think, what science can I use to make this decision? The previous outbreak of the original SARS virus, it looked like that virus lived best at 60 to 80 degrees. It's like 60 to 80 degrees is when it seemed to flourish. So I think that what a lot of folks assume is that this virus doesn't do well in the cold, and also that it doesn't propagate well other than those respiratory droplets. So what has been recommended by our federal government at this point is to avoid gatherings of more than 10 people. Yet again, another source of guidance. So there's so many different sources of what we should do and how we should do it. I think that practicing an abundance of caution isn't necessarily going to be detrimental for us. I don't know that we have to right now gather in large numbers, especially when there's such a call to our community to be present for those that are immediately and directly in need, those folks who need food, perhaps need medications, need medical attention, and need resources. So that's the work that I would like us to be focusing on doing, even though I think we do need support and to come together socially. And I'm sure perhaps these events maybe are being organized to address these sorts of needs, but also we should look at healthy, safe, using grandmother Spider's internet web, right? So using other ways of organizing to help us come to that place where we do achieve our goals. The way I think about it right now is I have a gentle radar screen. And I just look at that radar screen and think, what is, of all this information coming in, what is most important? And so in medicine, we call that triage, right? So what's strange right now is we're all having to become our own healthcare providers, our own personal assessment tool. And so when we look at what is important, those basic needs of ourselves and then caring for others, those are the things that I think we should really be paying the most attention to. If we need to be organizing to help those processes happen by writing or reaching out to our leadership, then absolutely we should be organizing. I would just gently question why we do need to gather in large groups right now, when really one-on-one interactions and helping people one-on-one, perhaps dropping off food, identifying people who need services and goods, and helping in our direct community and within our family. Those are the questions that need to be addressed.
Another question that I had from some of my listeners was, where can we find reliable information?
I found literally the WHO, the World Health Organization, is a really wonderful resource for me. Also, in particular for Alaskans, the Alaska Department of Health and Social Services has COVID-19 website with the information that you need for preparing personally and also for businesses and workplaces to prepare, recommending to transition to working from home to allow for this social distancing. Also includes information and links to these other resources, the World Health Organization and the CDC. So really starting with the state of Alaska, DHSS has been really helpful. So I just pull up their COVID page and remind myself what the status is, what's new, and that's a really wonderful resource. I do think also hearing the updates on Alaska Public Media for the updates that come out from the state is very helpful. Listening to Mayor Ethan Berkowitz talking with the healthcare leadership here locally is very helpful. Yeah, I would be cautious of social media to a certain degree unless you feel like it's coming from a very reliable source. And that's hard. What does that really mean? For me, I'm trying to post important information I feel that is somewhat for other providers to a certain degree. So, but also a lot of it is just for the general public. So I would say just be aware of who is posting and from which perspective. So folks say .org websites are more science-based and reliable. If the resource is cited, so if it's an article that actually refers to the published article that was scientifically studied, those kinds of resources I feel are quite reliable. When I'm hearing directly from the scientists and directly from the physicians, by oath, I said that I would respect and treat them in a particular way. And I really believe all of us are trying our best right now. How much science has gone into those recommendations and those studies. I hope that's helpful.
Yes, that is, definitely. What would you have to say to somebody who just says, this is just the flu? Like, don't overreact.
I have to say I hear that a lot. People have different access to information, and the information that I have says that this is not just a flu. Plus, we've had influenza epidemics or influenza infections for years. So we have natural immunity to influenza. We also have treatments. So it's a very different disease by nature. Also, it doesn't seem that influenza is quite as infectious. It doesn't spread as much. And we still don't really understand everything about this disease because it's brand new. And so that's unsettling. We want to think, of course, that it's just an influenza. But also, having said that, influenza is not a benign disease necessarily. It can affect many different body systems, and it can make people sick, and also be, not to be alarmist, but it can be lethal too, which is why we made all these treatments and why we tried to battle and gear up for flu season, right? So flu, even if it was just the flu, it'd be a big deal because it's spreading so much. But the truth is, it's not just the flu. It's a SARS COVID-19 virus, which is a very infectious and potentially very serious infection for some.
Would you mind talking a little bit about our history with, the flu pandemic of the early 1900s to see if there's anything that we can learn from the past to apply to today?
Great question. I know many of us are wondering about this, and many scientists are continuing to research how can we use that knowledge from that pandemic to help us now. So what we saw was folks from all over the world after the war coming back, traveling, going to different places, and unfortunately being able to spread the disease. And so not only was the disease spreading naturally, but then the human travel enhanced the spread of the disease. And what we noticed was there was a springtime and then a fall time curve that made the illness worse during those seasons because that virus does better in those conditions. So sometimes people say that there's humidity and temperature that are related to these. So when we look at the flu pandemic, I think we can know that this current pandemic is similar in that we're having a springtime outbreak. Some of us want to believe and assume that we'll have less cases in the summer. And some folks have hypothesized, they think that maybe in the fall that we might have more cases. I think right now we just don't know enough to say that for sure. But the trick with that unfortunate disease was that the mortality rate of flu is less than 1% by some standards today. But the 1918 Spanish flu epidemic had up to a 20% mortality rate. And my Irish great-grandfather actually perished in that epidemic in New York, in addition to our stories from my mom's side in our village. So that epidemic is very influential for many of us in our histories and in our families, and we can use that as a serious caution to just use extra caution. Why not right now, especially since we know this disease could potentially be dangerous?
What would you say is some of the biggest risks for rural Alaska and rural villages?
I'm reassured that most of us have a relatively mild illness, and some of us don't even get sick. The biggest risk is that we have sometimes more than one of us living in a smaller home. And so traditionally what we would do is maybe cook the spruce bough, maybe boil that spruce bough or let it simmer on the stove to infuse those natural aromatics that clean the air for us. So my grandma used to do that at her house, I'm told. And so actually my great-grandma used to do that. So I think that we have ways that we should remember of how to keep our air clean and how to use really good hygiene in these spaces. I'm concerned about, of course, folks who are elderly and folks who are on medications that influence their immune system. So that they're immune compromised. I'm concerned about folks who have a history of cancer and maybe having a compromised immune system in that way. I do think that also I know we're going to have to rely on each other and continue to rely on each other out in rural areas for resources. So trying to make sure that folks get the type of food and sanitation products that we need in addition to the healthcare resources that they need. So folks who are evaluating them and giving them information, just like we've been doing, but individually, so that folks can get the kind of guidance that we need one-on-one.
I think that there's been some discussion. I saw on the recommendation post that I did on Facebook that there was the village of Shishmaref and how in